you to the National Academies of Sciences and Engineering and Medicine, and to the Department of Veterans Affairs for hosting today's meeting to determine how the federal government plans to study the long-lasting impact of Manhattan Project waste on our veteran population. I included this amendment in the Honoring Our Pact Act because the U.S. Army Corps of Engineers, the Department of Energy, the Environmental Protection Agency, and the Government Accountability Office have all reached the same conclusion that the Manhattan Project left behind deadly levels of radioactive contamination that continues to impact the St. Louis region and beyond. If we know our community was likely poisoned due to improper disposal of radioactive waste, one of the next logical steps, I would assume, is to look into the health impact on veterans who handled and were exposed to these dangerous materials. Protecting our active duty military members from exposure to deadly chemicals, it should be among the highest priorities for the federal government, particularly the Department of Veterans Affairs, the agency which we all know is responsible for the health and well-being of service members. Their mission statement, if I can quote it, is to care for those who have served in our nation's military and for their families, caregivers, and survivors. So this study is one way that the VA can care for and protect the health of our veterans. The purpose of the PACT Act is to compensate veterans who have been exposed to burn pits, Agent Orange, and other toxic materials. Through an analysis of the health impacts of the Manhattan Project on veterans, we are closely following the intent of this transformative legislation. This study was designed to more equitably protect our veterans from toxic exposures to their health and their well-being in St. Louis and in other parts of the country. This study is just one of many components of my oversight work, fighting for environmental justice and remediation in my district. Though we know it is little known nationwide, St. Louis was home to one of the Manhattan Project sites right downtown, which is in the heart of my district. St. Louis continues to deal with the long-term consequences of environmental contamination stemming from the Manhattan Project waste in both St. Louis City and St. Louis County. And I say that because St. Louis City being even, it's a more densely populated area. In my work as a member on the Committee on Oversight and Accountability, I have secured a GAO report to understand the extent to which radioactive waste discarded from the manufacture of atomic bombs for the Manhattan Project, how it still threatens residents around Coldwater Creek, which is a creek in St. Louis County, which it regularly floods gardens and backyards, public school playgrounds with potentially radioactive water. Additional data is crucial to make sure that impacted people are made whole, and that has to be in our work. The consequences of federal inaction to mitigate exposure to environmental toxins, including lung cancer, bone cancer, leukemia, breast cancer, skin cancer, are staggering. If we are able to scientifically prove the health of veterans who worked with these toxins was negatively impacted, then we can make such a strong case to provide health monitoring to the civilian population surrounding these sites, in addition to providing justice and accountability for our veterans. Decades after the federal government generated large amounts of toxic nuclear waste for nuclear weapons production, this nation's most underserved communities still bear the brunt of deadly contamination. The Manhattan Project's nuclear contamination sites include schools. We know community recreation sites and airports, and GAO found more than 40% are near low-income and minority communities. Early last year, some of you might have seen an elementary school in my district, Jana Elementary, had to close down due to its proximity and exposure to nuclear contamination. This study is one small step towards environmental and racial justice under the leadership of the Department of Veterans Affairs and in close partnership with the National Academy of Sciences. I look forward to welcoming the committee for a site visit in the coming months, right in 2024. And I thank you all for your engagement on this issue on behalf of our veterans and our entire St. Louis community. Thank you all so much.
Well, thank you.